Welcome to another great edition of Beacons of Light. Joining me today is Coletta Barrett, who's Vice President of Our Lady of the Lake Health for Mission. And Coletta and I have known each other for a long time, and I've really admired her work and how she does such a phenomenal job keeping mission at the heart of everything that Our Lady of the Lake Health does. Why is mission so critical to everything you do at Our Lady of the Lake Health?
Thank you for the opportunity to be here today and to enter in a conversation. Mission is foundation to who we are. You know, as a ministry of the church, and Our Lady of the Lake is a Catholic ministry of the church, healthcare. We, our sponsors, the Franciscan Missionaries of Our Lady, religious order, just everything we do. You know, the mission statement that we subscribe to was created in 2000. Over 1,800 team members came together in this sacred space at the Tracy Center to create that mission statement in the year 2000. And it still drives who we are, how we respond, what we do, highlighting the core values of the ministry, and being our guide, our post for how we make decisions as we move forward as a healthcare ministry and, you know, a ministry of the church.
And certainly, I know you had to lean on that during the pandemic, and with all the changes that, you know, relative to healthcare, the mission is what guides you, right?
Absolutely. You know, there's a line in our mission statement that our new president, Chuck Spicer, truly just adapted to, and it says, with God's help, we are a healing and spiritual presence for each other and the communities we serve. And so it just encapsulates for us, you know, how we go about doing this. It's not about religion. Right. It really is about belief system and a faith construct. And we're a ministry of about 8,000 people, all God's children, caring for all God's children. You know, so mission being foundational was very, very important. As the pandemic began to unfold, that spirit of collaboration, communion with one another was how we as a Baton Rouge community responded. You know, 2 weeks into the pandemic, we, as all healthcare providers in Baton Rouge, all 5 institutions, Baton Rouge Clinic, Women's Hospital, Ochsner, Baton Rouge General and the Lake, came together to stand up that community testing site in the old parking lot at Baton Rouge General Mid-City when we didn't have test kits and nobody had enough supplies to do what we needed to do. So that spirit of collaboration and cooperation is what's present here in Baton Rouge. We shared practices, visitation practices when you had to shut down and limit visits. I mean, that was so disruptive to how we support families and how we make sure that we attend to the whole person, you know, the dignity of the whole person. And so sharing practices that we did together about visitation and how we protected our patients was really important.
When you reflect back and you think of all that was accomplished, and it's not like you had, I know you go through trainings, whether it be pandemic or whatever the issue, disasters, etc. But no matter how well you plan, this was off script. And for it to come together so quickly, just an amazing, you must have felt the Spirit just guiding the institution.
You know, yes, the Holy Spirit leads us in places and ways, and we just have to be listening to it and be open to it. And these are relationships that we've done as a community through the years. And so during times of crisis, you build trust. You understand how people make decisions. You understand that we're all in it for the common good. It's not about the individual institutions. And so it made it easier for us to be collaborative and to be able to respond as a community, to care for the community. You know, when we finally had access to vaccines, our first approach was to reach out to our faith partners.
Yes.
To our different churches across the community, to our Catholic churches, as well as to our religious partner churches, and say, how can we make your congregations, how can we help you help them be safe? And so our first distribution channels for community vaccines were through the churches in this community. So faith and organized practice, it's really present here in the Baton Rouge community, and something that I think that we want to continue to nourish and encourage.
Right. And it's not only the health partners and other people that you collaborated with, the churches, but Catholic Charities, St. Vincent de Paul, all of those social service agencies, there's an intersection between health and a lot of other things. And we'll talk in the next segment about social determinants of health. But those intersections and those connections are critical to Our Lady of the Lake Health, right?
Absolutely. You know, Michael, if access to health care and having access to medication or procedures or things or what made us or kept us healthy, Baton Rouge, we would be in first and second place with St. Tammany Parish as being the healthiest parish in our state. You know, for those watching outside of Louisiana, that's a county. We would be one of the healthiest counties. But the reality is that 80% of what helps someone be healthy or to maintain health has nothing to do with health care. Right. And it's all the other social needs that come into play that keep us either from being the healthiest that we could be. And that's what we'll talk about in our next segment.
Yeah, that sounds really, really good. And I know one key determinant that, well, to me it is your faith life. And it's essential because to get you through the pandemic, that you must have personally relied and seen your colleagues rely on that so much to get through those difficult days.
Yeah, we encourage our team members when we bring people in for orientation. We have about a 45-minute segment on mission. And in that segment, we talk about humility, we talk about service, we talk about prayer being foundational. And what we tell people is you cannot give what you do not have. So what do you do to feed your spirit? How do you care for you? Because research tells us that people who work in healthcare are terrible about caring for themselves. Mm-hmm. They care about others. They defer and delay their own self-care because they're caring for others.
Right.
And so, one of the things that we tell them is if you cannot name and claim what you do to feed your spirit, then you're not doing it for yourself.
Right.
And you cannot pour from an empty cup. And so you truly have to care for yourself in order then to care for others.
Well, that's a great way to end this segment. When we come back, we're going to talk about the social determinants of health and why it's so very important to pay attention to that and how Our Lady of the Lake Health is attacking this incredibly important issue when we come back. For over 20 years, the St. Vincent de Paul Community Pharmacy has served our area. We provide prescription medicines for those who have nowhere to turn for this most basic healthcare need. Please, if you need your medicine or you know a family member that needs their medicine, contact us. Kay, how can they get in touch?
383-7450.
Give us a call today and spread the word so that we can ensure no one goes without their prescription medication. Social determinants of health. If you've never heard of that concept before, with me today is Coletta Barrett, Vice President of Our Lady of the Lake Health Mission, and she's going to tell us a little bit of the importance of social determinants of health.
Michael, thank you so much for asking the questions about social determinants of health. It may seem like a novel or a new concept, but they have been around for as long as we've had people, to be honest.
Right.
You know, the determinants of health are those attributes or things that come together to help us be the healthiest that we can be. All right. So what happens is that there are these barriers or social needs that become evident. And so it's our inability to address those social needs is where we start talking about social determinants of health and how not addressing those negatively impact our health. And when we think of social needs, it's the basic needs. Do we have a safe place to live? Where we live is significant. Do we have enough food? Are we secure in how we're going to eat or the next few meals? Do we have enough financial security to pay for our basic needs, lights, water, electricity, etc.? You know, do we have transportation that gets us from point A to point B? You know, are we physically active? Do we have a social network? Do we suffer from social isolation? You know, there are 10 or 11 different aspects or social needs that come into play about us being our healthiest. And so therefore, what we're doing at Our Lady of the Lake is we have been screening for social determinants. We've had this going on now for about a year or so, and now just beginning to do a lot more education, awareness, hardwiring the process for assessments. Our patients now get these alerts when they come for their annual visit through their MyChart application to fill out their social determinants, to answer the questions. We are launching for our patients in the hospital to be able to do that through MyChart Bedside, so that the patients are in charge of the information that they share with us. But that information tells us the rest of your story. That's the important part, is to listen to the rest of the patient's story, or how else will we ever help them heal? And so understanding the other part of their life and the other parts of their story, and how we can connect them with the resources and the services that they need. And that's where Catholic Charities, St. Vincent de Paul, and the other ministries of the church have come together. You guys were in the first group that were there with us when we brought together the top 31 community-based organizations in our area to talk about how we communicate need, how do we collaborate, how do we protect the patient's health information, yet get them what they need with you all. And so St. Vincent de Paul was right there, front row, making sure to be present about how we address food insecurity, how we might address homelessness, you know, or someone who is housing insecure. And so how our community-based organizations come together and work with us, and we support them to be able to help address the needs of our patients. It's critical to the health of this community.
Well, it kind of goes back to what you said in the first segment, where you were just talking about how we all kind of come together, that collaborative spirit. And it is something that I think is critical, whether you're facing a pandemic, but also critical to getting to the root causes of many health, chronically health illnesses. If you're worried about food, not getting the proper nutrition, you know, you're worried about where you're living or making rent or whatever, that has all types of impacts on somebody's life. And I think you talked also about, you know, your staff and wellness care. That goes to that too. If you're not taking care of yourself, whether it's by choice, non-recognition, or what zip code you live in because there's not a grocery store in your area, all those things impact. And it's important that we all, I think the community as a whole realize we all work together. But it's something that they don't see. The very fabric of the community, when you kind of look under the blanket, it's all working together in a powerful way, don't you feel?
I think that we have a spirit of collaboration here in our community that many others don't. And I can share with you a specific example. In 2010, with the Affordable Care Act, one of the requirements was that not-for-profit hospitals had to do a community health needs assessment. Well, as time has gone on, there are many, many more communities across the United States that hospitals are collaborating with one another to produce these community health needs assessments.
Right.
Now, in Baton Rouge, we were one of the very first ones to do a collaborative and one of the first ones to do a joint community health needs assessment where all of the 5 hospitals in our community agree and produce the same assessment. But what makes us different, and no other community in the United States does this yet as well, is we also commit to one implementation plan. We have a single community health implementation plan that the mayor's office, the Mayor's Healthy City Initiative, publishes, and we all report our data in on that. And so when we all come at this from our different perspectives, but we're all working on the same things, we can move the needle on these social indexes faster and quicker. They didn't get broken in a 1 year or 3 year cycle, and we're not going to fix them in 1 and 3 year cycles, but it won't be multiple generations to do some of the things that we need to do because we're working together on the same issues.
Well, I mean, that's so remarkable. It's kind of like what you said when the pandemic hit. We're ready to do things together and to have a single plan. That just goes a long way. The efficiencies there, the effectiveness, and ultimately the health outcomes are out of this world. And sometimes, you pick up the paper and you see some negative things, but the real Baton Rouge, don't you?
One of the health outcomes that we're, I guess, most proud of is we've been able to reduce our HIV/AIDS rates. We still live in a community where it is a problem, but from 2016, when we all started doing out testing, Ochsner joined that work. Baton Rouge General is in the process of joining that work. We went from being number 1 in the nation in new AIDS case rates to being number 10.
That's a big
we dropped
difference.
9, yes, in 3 years. That's a significant drop because we know that testing early and testing broadly is the way to do that. So with every hospital, testing whenever someone comes to the emergency room and say, hey, we're test everybody for HIV. Well, if you haven't been tested in the past year, we're going to do that. It really makes a difference, and we're able to get people into care, and we're getting them into treatment. And when you do that early on, you can suppress the viral load in someone to where it's non-transmittable.
Which is just
the
great.
goal.
Yeah, just great news. And when we come back, we're going to talk about other great news. And by the way, Coletta is a champion, and when we come back, we'll talk a little bit about where she hit number 1 and is a true champion, and we're so thankful for her. The Society of St. Vincent de Paul's first cookbook, Taste and See, is the gift which helps share the goodness of the Lord with those most in need. Featuring recipes from Chef John Foles, each chapter begins with a short story about one of our special work programs. To order your copy of Taste and See, please call the Society or visit our website. Help multiply blessings for the neediest in our community.
My Bicycle Journey, a book that tells a story. It educates, it promotes, and it also provides some leadership. Take the time to purchase this book, and St. Vincent de Paul benefits from all of the proceeds of this book. Please, if you would, give St. Vincent de Paul a call and let me know what you think of My Bicycle Journey.
Some people say I'm a turkey, and today I'm going to prove it. We have a turkey carving contest, and everybody is a champion that participates, and Coletta participates every year, and she's a true champion, and she's going against some of the best. You got Hiller Moore, that even though he's a DA, he can handle a carving knife. You got Bo Clark, the coroner You know, he's a doctor, so he knows how to use a scalpel, but you do too. I mean, you get in there and wasn't it fun this year to see Bishop Duca, you know, for the first time come in there? He did a great job, didn't he?
He did. You know, it is so encouraging to have a bishop who connects with the people. When he first came to the Baton Rouge area, it was just a few months of him being here that we all participate in during Holy Week on Good Friday, when we have the Living Way of the Cross, or the Living Stations of the Cross downtown, as we go through the different areas in downtown. You know, for him to welcome the Baton Rouge community, and him not really, he's like, that's my first time being here, we're going to figure it out. I mean, he is a bishop of the people.
He is.
Very thoughtful, asks really good questions. And where healthcare is concerned, he asks very, very probing questions about Catholic identity, commitment to ministry, the ethical and religious directives, making sure that we are truly Catholic in how we go about doing our work. And so very pleased to have him as our leader.
We are blessed, and he's good with a carving knife too.
Good with a carving knife.
And you know, that Thanksgiving event, which they're going to be showing pictures throughout this segment of you
and
I
the love
bishop. And, you know, it's so much fun, but it creates an awareness of the social determinant, hunger, and how much hunger there is that exists in the community. And, you know, while we want to focus on that food insecurity, we also want to celebrate success. When different groups and different individuals and different faiths come together, you know, Rabbi Sarah Smiley was with us, and Ralph Bender, who's going to be on this show. I've got an invitation out to him. He won, you know.
Did.
Great coming together of a multitude of faiths, walks of life, political leaders, and it's all about the importance of serving others. And that's at the core of Our Lady of Lake Health. It's about reaching to those who truly, ultimately, you know, when somebody checks into the emergency room that's homeless, who suffers from one of those negative social determinants, poverty, experiencing homelessness, that y'all are geared to help them with their healthcare need, but try to discharge in a way that's compassionate and puts them on the right track.
Yeah, I'm so glad you brought that up. You know, in looking at how we care for our community, you know, there are many healthcare organizations that will talk about frequent flyers, you know, people who visit your institution over and over for the same thing. We subscribe and we call those citizens our familiar faces. Language is important and words are significant, and so we call them our familiar faces. We're familiar with them. You know, we started a project in 2016. The American Hospital Association launched this 1, 2, 3, 4 equity. It's about looking at equitable health care and how we treat all God's children, and looking to see where there may be disparities in how we deliver health care. And so we chose to focus on our familiar faces in the emergency room and looked real intently at, were we connecting our familiar patients with primary care, because you shouldn't seek routine care in an emergency room. And we found out that only 23% of our patients were keeping their primary care appointments or actually following through. And so one of our social workers, Alvin Smith, who is very relationship-based focus, you know, did an assessment. We call it a GIMBA. We attached ourselves to the process. And what we found out was we were very transactional in our approach with that. Here's your doctor's appointment, here's your date and time, we'll call you. When he flipped the model and we were no longer transactional in our work, we were relationship-based in our work. The first phone call was just following up to see how you're doing, how are you feeling since you've been discharged from the emergency room, what's going on. And by the second or the third phone calls, when we said, now don't forget you have that doctor's appointment, you know. And so when we flipped that model from being transactional to relationship-based, 76% of our patients started keeping their appointments. We were making We were making arrangements for rides. People didn't have rides to get to their doctor's appointment. And so you could arrange, transportation services. So when we listened, when we started truly listening to our patients, we were able to then address those needs. And those are some of the most difficult of our community, but very familiar to us.
Well, you mentioned Alvin. We were talking about champions earlier. He is a blessing to Our Lady Lake Health. And we, whether it's St. Vincent de Paul, and I'm sure Catholic Charities as well, we partner with him and the crew there at the lake all the time.
Yes.
Relative to, it kind of gets back, every person that the lake serves, St. Vincent de Paul, Catholic Charities, all of us serve.
Mm-hmm.
It's a blessing. It's a child. You said it earlier. We're all children of God, and what a blessing it is to serve those who truly need that helping hand.
Caring for those most in need is part of our mission. The sisters came here in 1923. They came to the United States in 1911 and established in Monroe in 1913. And they were invited here to Baton Rouge in 1923. So guess what this year is?
It's 100.
100 years of faith and service and commitment to community. And so as we embark upon our centennial, which will be November the 4th is the actual date, but we'll celebrate with Mass and the bishop being present on November the 3rd on our campus. And then afterwards in that year following up, celebrating, how our commitment to community continues. While we've been here for a century or 100 years, our commitment and the sisters' commitment is to be here for the next 100 years.
And that is just a wonderful way to kind of end the show, because the society has been here for over 100 years as well.
Yes.
And when you talk about Catholic groups, you see that we've got about 30 seconds left. Decades of service shows commitment at a different at a different level, doesn't it, Coletta?
Yes. To whom much is given, much will be expected. And we are God's hands and God's feet in today's world.
No doubt about it.
His work happens through us.
Coletta, thank you for everything you do for our community, for those in need. And we're at St. Vincent de Paul, our partnerships, all of them, whether it's prescriptions, dental, homeless shelter, whatever it is, we count our blessings for you and Our Lady of Lake Health. Y'all do such a magnificent job. And little charities like St. Vincent de Paul and Catholic Charities, we are all really thankful for our partnership. Thank you for what you do. If you're interested in getting involved with St. Vincent de Paul and some of our wonderful programs, go to our website at svdpbr.org and get involved today. We'll see you again next week on Beacons of Light.